The first case of the deadly Mpox virus has been reported now in Pakistan's Khyber Pakhtunkhwa province. This comes just a day after Sweden confirmed the first international case of Mpox in the year 2024, marking the virus's potential spread beyond the borders of Africa. These developments follow the World Health Organization's declaration of Mpox as a global health emergency earlier this week. The Pakistani patient, a man who recently returned from Saudi Arabia, has been quarantined while his sample undergoes confirmatory testing. This case has raised alarms as the Mpox virus has already claimed over 520 lives this year, with a fatality rate of approximately 3.87%, or about 1 in 26 people. Originating in the Democratic Republic of Congo, where 96% of cases have been recorded so far, the virus has primarily affected children under the age of 15, who now represent over 70% of Mpox cases and account for 85% of the deaths in Congo. Mpox, which is part of the smallpox family, spreads through direct contact with infected animals and contaminated materials. While symptoms can range from mild, such as fever and body aches, to severe, including skin lesions and sores, this newer strain of the virus is particularly concerning because it targets the genitals, making it harder to detect and increasing the risk of spread. On the European front, the European Centre for Disease Prevention and Control, ECDC, has raised its risk level for Mpox after the confirmation of the first case in Sweden. Although the ECDC maintains that the risk of sustained transmission in Europe is low, they are warning of more imported cases in the coming weeks due to close links between Europe and Africa. In response to the outbreak, the Red Cross and the Red Crescent have emphasized the urgent need for more diagnostic kits, treatments and vaccines in Africa. Meanwhile, global vaccine group Gavi has announced that it has up to $500 million available to fund the distribution of vaccines to affected countries. Pharmaceutical companies are responding swiftly as well. Danish biotech firm Bavarian Nordic saw its shares soar after submitting data to extend the use of its Mpox vaccine to adolescents. New Jersey-based Tonix Pharmaceuticals is also advancing the development of its Mpox vaccine candidate with a sense of urgency given the global health emergency. As the situation unfolds, global health officials, including the World Health Organization, are advising against any travel restrictions, but they've called for heightened monitoring and preparedness. China, for example, has announced plans to monitor people and goods entering the country for Mpox over the next 6 months. In these uncertain times, with the memory of the COVID-19 pandemic still fresh, health experts emphasize the need for vigilance, early detection, and swift response to prevent Mpox from becoming the next global crisis.
The World Health Organization has declared an outbreak of Mpox a global health emergency, following a similar announcement by the Africa Centers for Disease Control and Prevention. Here's what that means. The WHO also declared Mpox an emergency 2 years ago, when a form of the disease began to spread globally, largely among men who have sex with men. That outbreak was brought under control in part due to vaccines. However, Mpox, which spreads through close contact, has been a public health problem in parts of Africa for decades. Democratic Republic of Congo is experiencing its worst outbreak ever. 27,000 cases and more than 1,100 deaths since January 2023, largely among children. 2 strains of the virus, which cause flu-like symptoms and pus-filled lesions, are now spreading in Congo, the endemic form and a new offshoot. And it's this new form of Mpox that has triggered global concern. That's because it seems to be spreading more quickly, and little is known about it. It moved from Congo to Rwanda, Uganda, Burundi and Kenya, and then outside Africa's borders. The WHO has issued a public health emergency of international concern, the highest form of alert. That's done when diseases are spreading in new or unusual ways. The aim is to galvanize international cooperation and funding.
A coordinated international response is essential to stop these outbreaks and save lives.
Scientists hope efforts to get more medical tools and funding to Congo will be sped up to help tackle the outbreak and study the virus. However, in 2022, a WHO appeal for $34 million to fight Mpox got no take-up from donors. There was also huge inequity in who got access to vaccines. African countries did not receive the 2 shots used in the global outbreak, made by Bavarian Nordic and KM Biologics. 2 years later, that remains the case, though the WHO has appealed for donations from countries with stockpiles. The Africa CDC has said it has a plan to secure vaccines without elaborating, but stocks are currently limited. Mpox is a significant health problem that is killing some of the most vulnerable people in the world, including children. But it is not COVID-19. So far, there is no evidence that it spreads easily through the air like COVID. There are also proven tools to stop the spread and treat those most at risk. The challenge now, which the emergency declarations have aimed to highlight, is to make sure those tools reach those who need them most, in Congo and its neighboring countries.
कि इस वक्त 2024 का पहला केस खैबर पख्तूनख्वा के अंदर रिपोर्ट हुआ है। केस हम कंफर्म कर चुके हैं तो पीसीआर और जेनेटिक सीक्वेंसिंग के लिए इसके सैंपल को एनआईएच इस्लामाबाद भिजवाया जा चुका है। प्रिवेंशन के हवाले से, कंट्रोल और मैनेजमेंट के हवाले से मेजर्स है, सहूलियात है, उसको महकमा सेहत इंश्योर कर रही है। बॉर्डर्स के ऊपर हमने टीम्स को अलर्ट किया है जो बॉर्डर हेल्थ सर्विसेज है कि जितने भी मुसाफिर आए और कहीं पर अलामात जाहिर हो तो उन सबको देयर एंड दिन स्क्रीन किया जाए। जो ऐसे मरीज है जो कि मुश्तबह पाए जाए उनको पेशावर के अंदर ही आइसोलेट किया जाएगा और फर्दर उनको मैनेज भी किया जाएगा।
We have Dr. Ishwar Gilada, Secretary General, People's Health Organization and infectious diseases expert, joining us on the broadcast. Thank you, Dr. Gilada, for being with us. And we also have Dr. Puneet Mishra, epidemiologist and professor of community medicine at the All India Institute of Medical Sciences in New Delhi, joining us. Dr. Mishra, thank you so much for taking time to be with us. I'm going to begin with Dr. Ishwar Gilada. The question here at this stage is that what is the level of precaution do you think the public health system in the country, in India, needs to take at this stage, considering the situation? It has reached the shores of Pakistan already.
Thank you very much for having me on the show. India at this stage need not panic. We need to be prepared. We need to be vigilant. We need to do, if we find cases, test them, do genome sequencing, number one. Number two, because it's a once bitten, twice shy. We have had a very bad COVID pandemic. Therefore, we start comparing everything with COVID. COVID was transmitted through droplet infection, through aerosols, through surface. But monkeypox or Mpox is not transmitted through this kind of modes of transmission. Up till now, barring the current episode or current outbreak in Africa, 99% cases were through sexual transmission, and mostly most of them were all male sex with male. Hardly few female, and only 1 or 2 children were there in 90,000 cases from 22 to 23. Now, current episode is of clade 1B. Earlier, all the infections were from clade 2, which was Western Africa, which was highly infectious but less lethal. This is more lethal and less infectious than the previous clade. Number one. Number two, in this current outbreak, 70% of the cases are children below 15, and 85% of the deaths are in children. So basic, whatever total deaths are there, they are in children. So therefore, we need to keep studying whether it is sexual transmission or any close contact in the family. So in the family, if somebody gets sexually transmitted and then transmitting to children, what is happening? Whether it's child sexual abuse, whether early sexual activity. So we need to study that. Those things are not coming out from anywhere from Africa. Even before that also, nothing was coming out of Africa. The studies were done mostly other countries. Those 60% cases even that time were from Africa. 20% cases were from America and 10% cases from Europe. All these studies were done only in the remaining 30% cases like either America or Europe. So basically we need to understand number one, mode of transmission. If it is not aerosol, if it is not surface transmission, nothing to worry. Secondly, those who have been vaccinated against smallpox, that means we stopped smallpox vaccination in India in 1989. So those people who are born before that, they are very much immune to Mpox. And even if they get, it will be very, very mild infection. So we are looking at a population between 20 to 45, which are sexually active population, and particularly among them, which are having multiple sexual activity, male sex with male, people frequenting sex worker or bisexual.